what is the best way to manage labor so that when the baby actually arrives, provided you can actually manage labor, that you still have some energy and strength in all of
Want
this?
my simple one-word answer to that? It's epidural. And I'm not being, facetious. I honestly can tell you from delivering thousands of babies that the women who are comfortable during their labor look back on their labor and delivery with a very different eye than women who are screaming for hours, crying in pain, uncertain when it's going to end, hate the whole process. And it's not black and white. It's not, if you don't have an epidural, you're going to hate the process. I had 2 babies without epidurals. I loved all my processes. But again, if you're talking marathon, if you're talking long time between actually starting to feel uncomfortable and actually being able to push a baby out, that period of time can be looked back on as either the worst thing you ever experienced, or I felt okay. I took a nap and then I woke up and I was pretty much ready to deliver. So again, I'm a big advocate for people having what they want, because if people tell me, nope, under no circumstances do I want an epidural, it warrants a conversation as to why they feel that way. But if they truly, really feel that way for some valid reason, that they like to feel pain of contractions, if that's what they want, then that is what they're going to remember their delivery experience being like. And just again, from my experience in delivering so many people, the ones that went through the process more or less like, okay, now I'm uncomfortable. I don't want to walk around and rock on a ball or do any of those things. I want pain relief. The people that get the relief from that point on until they deliver remember it very differently.
Can you actually see any difference in maternal stats such as blood pressure, heart rate, anything else?
You meaning with an epidural or?
Yeah.
Well, obviously, an epidural has the potential to lower someone's blood pressure enough to a point where it might become an emergency. But anesthesiologists and nurses and doctors taking care of people who are going to get epidurals should be aware of the hydration status of the patient and make sure that they're not going to cause a problem with their epidural. I mean, I had the last delivery that I did a couple of weeks ago was somebody who was a first-time mom, came into the hospital kind of for an induction. She was already 2 centimeters dilated, very, very uncomfortable. So we said, let's just go in and get the process started. Gave her 1 pill of Cytotec or misoprostol, and she went into her own labor. So it was really a nice process. Got an epidural. Didn't have a problem with her blood pressure right after the epidural, so it wasn't an epidural issue, and it was on a weekend. I happened to be in my office doing some administrative work, which my office is down the block from the hospital, and got a call from the hospital. It was about an hour after her epidural. You need to come here right now. Went there. This goes in my next book. Went there. I went to the patient's room to see her. She was gone from the room already. They had already moved her into the OR, knowing that I was going to have to stat section her. I had my street clothes on. I went into the OR, which is a total no-no. You can't walk in the OR without scrubs. I was like, I'm going in there. Went in, she was panicking, crying, comfortable with her epidural, didn't feel anything. Baby's heart rate was like in the 70s and had been there since they called me. I said, just give me a gown. They gave me a gown. I just sectioned her in my street clothes, that's the only second time I've ever done that in my life, and got the baby out. First of all, she had gone from 4 centimeters to 9 centimeters in like a minute. And if she had been 10 centimeters and I could have put a vacuum on the baby, I would have pulled the baby out instead, but she was only 9 and the baby's heart rate was still down. So I was like, sorry, got to section you. So I said, just give me a gown. I sectioned her. Baby was out in like 2 minutes. The cord, the umbilical cord, not only was around the baby's neck, but was only this long after the loop around the neck. So what had happened when she rapidly dilated and the baby moved down right away, that cord, it doesn't choke the baby, but it became so taut and cut off the blood supply that no blood supply to the baby, heart rate went down, and baby came out a little stunned, but ultimately the baby was okay. So, you know, anything can happen. And of course, immediately I thought when they called me, I thought they were calling me to say, she just got an epidural and her heart, everything, you know, went down. And I was going to say, make sure she has enough IV fluids. But the call was, you need to come here right now. And I just flew over there. And like I said, that it was like one of the most emergent sections. And the baby was okay. The baby was fine. We did the tests on the, you know, the pH of the baby's blood, and it showed it was like a 0.1 away from needing cooling. So but it was okay. And
that's why we do monitoring.
Yes, that's why we monitor. That's why anybody that's, you know, in labor, in active labor, should be on a continuous monitor, and somebody should be available all the time. So anything can happen. And, you know, and I saw her already. So that was 3 weeks ago. And I saw her this week for her 2-week incision check. And she's a setup, of course, for postpartum depression and for, you know, what a trauma, you know, to come in. I come in, that was one of the first times I ever came into the hospital, and they didn't wait for me to say, go to the OR. They already took her in knowing that when I came in, I was going to have to section her. That's unheard of. They don't take anyone to the OR without the doctor saying, get her in the OR, I need to, you know, and then me going back, changing into my scrubs, and then getting in there on time. I mean, I got to the room, only her mom was there crying. She's like, I was like, where's your daughter? She said, they took her. I'm like, they took her, I'm the doctor. What do you mean they took her? Where'd they take her? So it was crazy, really crazy. But I saw her at her 2-week visit. She seems fine. Her depression score was not high, but we debriefed. We had a nice 15-20-minute conversation about exactly what happened and why it got to that, and that it wasn't anything she did, or it wasn't the epidural. It would have happened anyway when she started pushing. If she had gotten to fully dilated, like over a very short, a much longer period of time, and she would have started pushing, when she would have started pushing, the baby would not have tolerated it. We would have ended up in the same situation. So all in all, better baby was out than in, but it was the nurses were traumatized.
So since you're the one who's supposed to make the call, because you are the doctor, who made the call to hustle to OR?
The charge nurse. But they didn't call for section. They called to go into the OR, because when I came in, then I would be able to say either, yes, let's try for a vaginal delivery, which we could have done in the OR, or no, just section her. So, you know, and they knew I was on my way. If they moved more quickly, then it would have been less time to take up once I got there and said, oh yes, go to the OR. Let's have, because thank goodness some of the nurses there are these old time nurses that they're like, they know what I'm going to say when I get there. They know me well enough. I've been there, 12 years.
Can I ask a question about epidurals? Just because we hear this kind of a lot, I want to say in the groups, do epidurals stall labor or cause any problems during labor?
They don't stall labor if you get it at a time where you should have gotten it anyway, which is where you're already either approaching or in active labor, or uncomfortable enough that you can't manage the pain that you're going through to get to the next step of labor, So if you're having that many contractions that you're that uncomfortable, then pain relief is just pain relief. There's no anti-contraction medication in there. There's nothing that will stop your labor from progressing, as long as the caveat is you have enough contractions to move you towards active labor in the first place. So as long as you're in the right place to receive it, by what mechanism would relieving your pain stop your labor? You're already in labor. We may have to give you something now to make your contractions meet criteria for moving you along to fully dilated, but so what? You need the contractions, whether we give them to you or you have them on your own. So it doesn't really matter. But there's nothing inherent in an epidural that will stall your labor. I mean, I've never really heard of anybody getting an epidural when they're 1 centimeter dilated. Maybe that would have an effect, but that's too early to get an epidural. So, if they're given at the right time for the right reason, there's really no effect, and totally no effect on the baby that we know of.
You know that some people from the natural community are like scared of epidurals or put the fear of epidurals, but I have friends that swear up and down, like, get an epidural, it's the best thing that could ever happen. And I've had friends that were getting close to, they were getting to that point where they're kind of washing and they're like, they're going to end up going in for a C-section, and they got that epidural and they just, it just was what they needed for her to calm down, get that relief, and then she
And it's
just
also
fully
not-
dilated.
Yeah,
There
it's
you go.
also not true in the community where they say that if you're stressed, you can keep yourself from dilating. And once your pain relief, no, it's not that. It's that the epidural has some effect on relaxation of all your muscles. It's not like it can't make you dilate more, but I definitely have seen people that they're in so much pain and just going, peeling them off the ceiling from the pain of their contractions. And finally, they're able to conserve their energy and relax so that later when they need to push, they'll have that. So that's a big benefit.